Hi guys, Dr. Fo. Today I'm going to be releasing you from the shackles of the so-called Staphylococcus aureus infection. It's quite alarming that everywhere in Nigeria, everywhere you go to, you keep hearing Staphylococcus infection, and many persons have been exposed to different kinds of medication or treatment, all in the name of trying to treat Staphylococcus infection. And this can be coming from professionals, professional health workers, and non-professional health workers, or those who are not health workers. And some persons are just there solely for the money.
Him now. It can take your money eventually.
Really?
Yeah, for vanishing.
Okay, so I would like to explain certain things in this video. First of all, I'm going to explain the various relationships that exist between a host and a microorganism, in this case the human and this microorganism, including Staphylococcus species. Now we have the symbiotic kind of relationship where both parties benefit from each other, all right? And then we have the parasitic kind of relationship where one benefits from the other and at the end harms the other person. It's like Mr. KK, who owns a small business trying to grow up, and then he falls in love with Nkechi, and Nkechi does not love Mr. KK, and Mr. KK keeps spending on Nkechi. Nkechi keeps collecting, and at the end of the day, KK got broke, and Nkechi.
You get it? If you don't get it, forget about it.
All right. And then we have the commensalism. Commensalism, one party benefits from the other, while the other one does not benefit. However, no one is harmed in this kind of relationship. We have a lot of commensals in our body, of which Staphylococcus species is one of those bacteria that exhibits commensalism. Commensals do not cause problems. They actually benefit from us, and sometimes even help us seriously. Okay, most of them are normal floras in the body. That means they are there, they colonize the body, but they do not cause problems. For commensals or normal floras to cause problem in the body, it's either they left the place where they are supposed to be and went to other place. For instance, Staphylococcus is almost everywhere on our skin. However, they will cause problem if they leave the skin and goes into the pores, the skin pores, or they leave the skin and through the blood goes to another organ. They cause problem. And then if there is an overgrowth of those bacteria beyond what it should be, they can also cause problem. And then body immune system also plays a very huge role in curbing the overgrowth of these microorganisms. And of course, for those who have lowered immune system, these microorganisms can cause problem. Now, the vagina has a lot of microorganisms called microflora. It has a lot of microorganisms. They colonize there and they don't cause harm. There's actually a delicate balance between the good microorganisms and the bad microorganisms. For instance, predominantly lactobacilli are very, very beneficial to the ecosystem of the vagina. They actually dominate over the vagina population, microorganism population in the vagina, and they also produce lactic acid that keeps the vaginal pH low, making it acidic and unconducive for harmful microorganisms, and then preventing overgrowth of those harmful organisms, And lactobacilli is not the only microorganisms there. Like I said, there is a delicate balance between beneficial ones and harmful ones. Staphylococcus aureus is one of those bacteria found in the vagina. You get infection, vulvovaginal infection, if there is a break in this delicate balance, if there's an overgrowth of the harmful ones and all that, certain things that can actually kill the good microorganisms, like the lactobacilli I mentioned, example, douching, use of tampons, excessive washing of your vagina with chemicals, harsh chemicals, putting on tights, panties and fittings, stress, drugs, antibiotics, so many other stuff can actually kill these good microorganisms, these good bacteria, and then allowing the bad microorganisms such as the fungi, candida, and other harmful microorganisms to overgrow and start causing problem. The question I usually get is that most labs and hospitals, after running tests, maybe doing a vaginal swab, a vaginal discharge swab, and they discover that it's a growth of Staphylococcus aureus, and they keep asking, why is that so? Yes, it's possible. Like I said, if there's an overgrowth of Staphylococcus, it can actually cause that. However, I discovered that most lab scientists do not know how to collect, sample for microscopy and culture test. In recent times, most of my patients I send for vaginal swab, microscopy, culture and sensitivity test come back with results showing growth of Staphylococcus aureus, and it kept on recurring. And then I tried to find out the reason for that, and then I discovered that collection of these samples were poorly taken. I think that's why most of the results comes out, with overgrowth of Staphylococcus aureus. In this case, I usually do not rely on the lab results only. I also apply clinical knowledge. Take my history. I need to know the color of the discharge, other symptoms apart from the discharge, to help me land a good diagnosis. And what can cause vaginal discharge? It can range from vaginal thrush caused by Candida albicans. You can actually have bacterial vaginosis. You can have trichomoniasis. You can have pelvic inflammatory disease. You can have various forms of sexually transmitted infections. And when this happens, it is not always Staphylococcus infection. So the right medication must be taken. If not, we keep falling victims of those roadside drug sellers and keep shouting Staphylococcus aureus, Staphylococcus aureus. Thank you so much for watching. I hope you've learned one or two things. Before I end, we are on a project of achieving at least 1K subscribers before the end of November. So you are watching, have you subscribed?
I don't want peace. I want problems.
So one of the things that encourages us to keep pushing is when we see the number of subscribers increasing every day, and it really encourages us. So thank you so much for watching. Thank you so much for watching. I'll keep bringing interesting videos, and thank you very much.